My workshop was on citizen engagement and trying to develop an asset-based rationale for citizen engagement, because lots of the time the way in which it's framed, getting members of the public delivering services or doing activities around health, gets framed as around deficits. Oh well, the service hasn't got enough staff, we need to bring in some volunteers and so on. But it's thinking about it in a different way, and so I drew on the findings of our big research study, People in Public Health, and looked at the 6 reasons why services might want to involve members of the public in delivering health activities. I set the people in the workshop a challenge of thinking about the wider, the international examples that are around involving members of the public, lay health workers, community health workers and so on. And actually what we've got is loads of examples throughout the world of where really big scale programs, but that doesn't tend to happen in this country. So we've got a challenge how to do it in a more systematic way, try to get people thinking about that, but also thinking about the skills that people bring, because our study found that people bring loads and loads of different skills, and some of the social skills and the ability to bring people together, to communicate with people are quite high level skills, and yet all the time we frame volunteers and so on as not professionals, again in a deficit based way, whereas what the workshop was trying to think of, well, what sort of skills do members of the public bring? What things do they bring, like their community know-how and so on, that complements what professional services do? And so I'm hoping that people taking part in the workshop will have taken some of that away with them, thinking about skills and how they can, just frame the whole area of citizen engagement in a different way.